The proton pump inhibitors are widely used and can also affect the gut microbiome. They are acid-reducing medication that is available over the counter and used for conditions like heartburn, acid reflux, and ulcers. While they are very effective in lowering stomach acidity, they're not the same as an antacid or even an H2 antagonist like a Axid or Tums, which is more of a calcium product. Antacids provide immediate relief by neutralizing the stomach acids, while PPIs work by inhibiting the production of acid in the stomach for the full time, durating 24 hours until the next dose. In this schematic, the authors conducted an extensive literature review assessing the long-term effects of proton pump inhibitor use and its association with various adverse outcomes, including drug interactions, nutrient deficiencies. They found a wide host of problems, and we're really fully trying to understand this after decades of using proton pumps widely. This includes magnesium, vitamin B12, deficiencies, bone fractures, central nervous system effects, including associated dementias, and alterations to the intestinal microbe. In the microbiome, it is thought to be associated with changing the types of microbiome in the different parts of the gastrointestinal tract. And you can see a higher incidence has been also associated with SIBO. So the alterations to the intestinal microbiomes are very relevant with proton pump inhibitors. When we look at PPIs and gut microbiota changes, this slide shows that you change the microbiome diversity depending on where we're looking at along the gastrointestinal tract. And that's the main focus of this slide. And so by putting organisms in the wrong places because of the acid suppression, we think that, in fact, the overall impact is destroying a portion of the gut microbiota with chronic use of proton pump inhibitors, creating an empty niche that allows Clostridium difficile to colonize and overgrow. There's also associated with the risk of enteric infection caused by Salmonella, Shigella, and Campylobacter species. So overall, we have a balance to achieve in trying to look at strategies to reduce microbiome damage. The role of antibiotics that we need to be very careful with and not be treating viruses with antibacterials in the first 3 years of life, being judicious with antibiotics because that's going to be the critical phase that we discussed of developing and populating the gut microbiome, trying to reduce drug microbiome interactions. Patients are on certain drugs to try to dig a little deeper and look at the interactions and, when appropriate, what are the things we can do to restore the microbiome community. We know fiber supplementation is going to be important, using probiotics and the right ones when appropriate. And then in the worst case scenario, patient develops C. difficile, fecal microbiota transplantation has been successful.